Hi again, everybody. This is Dr. Tim Newton with Inspire Movement Physical Therapy. In today's video, we're going to show you some shoulder stretches that we really like to help loosen things up. Before we go forward with any shoulder stretches, we first need to remember the fact that a lot of these muscles, when they get tight, it's that they're the result of a problem in another area, okay? Very often, shoulder muscle tightness is protective in nature, and it could be the result of restrictions in the neck, the upper back, the rib cage, or these joints right in here, the sternoclavicular joint in particular. We've got videos where we demonstrate how we get the shoulder looser by treating these seemingly unrelated other areas, and then motion is restored without having to do a single stretch. I highly advise you to check out our videos on that before going forward with this. Sometimes, though, we do still have mobility restriction, or we want to maintain the gains that we've gotten in treatment. So we do have shoulder stretches I'll show you here today. We're going to show you a couple of the main muscle culprits that get tight and restrict our mobility. We're going to talk about how to stretch the pecs in the front here. We're going to have you turn around here and face the wall behind you. We're going to show you how to stretch the muscles in the back of the rotator cuff, also known as the posterior capsule of the joint. And then we'll also show you some stretches for the latissimus dorsi and the quadratus lumborum, which are big restrictors in overhead mobility. So without further ado, let's go and show you what we like to do to stretch those out. For each of these stretches, you can do them for 20 to 30 seconds per arm. And you can do them several times if you want to. Really just kind of feel what gives you more flexibility and mobility afterward. And for all of them, you don't want to be hurting your joints or anything like that. You want to feel a stretch in the musculature. First one we'll show you is the posterior capsule stretch. I put that in quotations because it's probably more of a muscle stretch. Traditionally, this was a stretch where you had the arm going across the body like that. We are actually not advocating for that. And the reason is that it does strain the joint, especially people who are a little bit loose. That ball can slide out of the back of the socket. It can also cause compression in the AC joint. Instead, we rotate the arm as we do it, going up and bending the elbow, and she has her palm facing this way, and then this isolates the muscles and protects the joint a little bit better. All right, so this is what we do for the stretch of the posterior capsule, or just the rotator cuff musculature right back in there. Okay, so that's the first one. The next stretch is for the Pec Minor muscle. All right, that's this one right up in front. When it's tight, it holds our shoulders forward. We want our shoulders going backward, okay? So again, we've already treated restrictions in the rib cage and the upper back, and now we're giving this as a home stretch. So what she's going to do is just reach back on the wall as far as she can comfortably go. Now she's trying to find that sweet spot. She may be more comfortable with the elbow a little more bent up, or maybe with a little bit more straightness in the elbow. She finds whatever works for her and her shoulder. This is a very easy one to overdo, so don't crank it. Just try to find a good stretch for this area here. If it's hurting the shoulder itself, I wouldn't continue with this, okay? It's not worth it. But she finds this spot, and if she finds a good stretch that she can tolerate, she gets there, she's feeling it right here, and then she can just rotate her trunk away just a tiny bit, and she's feeling that stretch right there in that pectoral area. Okay, so that kind of helps her get out like that. She's getting more mobility into external rotation of the shoulder. Okay, so now for the stretch for the lats and for the quadratus lumborum, okay? The lats are here, the quadratus lumborum are down here. They're both very important to have loose. They need to be able to extend for us to reach the arm up overhead. So we'll start with the lat. We'll show you a post here. We're going to use the leg of a table. She's going to grab that with her thumb up on the post. Now you could do this in standing too. You just sort of lean forward and grab a pole or something like that. This doesn't have to be done in all fours. But she holds on here. She's elongating everything here. That's stretching that big latissimus dorsi or lat muscle. And then she holds here. She can lean a little bit to accentuate the stretch. She can also take a deep directed breath into this side of her rib cage to really, really loosen it out there. All right, so that's how you stretch the lats. Okay, if it's hurting the shoulder, you need to back off a little bit, maybe lower your hand down on the pole, or just find some kind of difference in setup. We don't want to be aggravating the shoulder. So that's basically how that's done. Now for the quadratus lumborum, we're already in the same position, but she switches her hands where her thumb is down. That change in rotation takes the tension out of the lat and then directs it to this powerful side bender down here in the trunk, the quadratus lumborum. When this gets really, really tight, it holds the whole shoulder complex down. All right, so and then it's hard to reach up overhead. So this is pretty much how you do it. And again, she can lean into it a little bit more, focusing on feeling the stretch in there. She can take a directed breath into it. And these are the stretches that we like for the shoulder. And just remembering too, before we're doing these two here, we're doing treatment to this lower thoracic spine. A lot of the time the muscles will just loosen up on their own. And for the ones we talked about earlier, the posterior shoulder capsule and the pec minor, we want to be looking up higher in the spine and the rib cage and make sure we treat out restrictions in that area too. So that's it. That's how you stretch. All right, that's how you do it. That's how you can start stretching out muscles that are restricting the shoulder complex. If you found this video helpful, leave us your questions and your comments. Don't forget to subscribe and give us a like. And for more related material, don't forget to check out our website at marylandmanualtherapy.com. Thanks for watching and have an inspired day.